Trauma-informed care is a philosophy of looking at how we provide services for people, not just psychiatrically, but across all areas, knowing that trauma has an impact on everything that we do. Especially in healthcare, things were usually segmented. Well, that's a psychiatric problem, that's an endocrine problem if you have diabetes, that's another person's problem if you have chronic pain. But really now, trauma-informed care is where the entire organization of healthcare delivery systems understands that trauma impacts every part of the human body. Trauma has showed up in so many ways in the last 2 years because of COVID. It starts with, of course, the patients and the traumas that they have experienced of everything from being shut up and not being able to socialize with their friends or families in order to see loved ones and not be with them when they passed away in the hospital because of the restrictions that we've had to be alone when they've had to go to a doctor's appointment, to worry about the fact that they have had a procedure postponed because of something they couldn't control. These are all traumatic experiences that all of us had in one degree or another, and it was so important for us as a health system to recognize that and to understand that, especially being here in Sussex County. I think for my staff, also a very important thing. It was such a traumatic experience. We didn't know if wearing a mask was going to save us, if we had to go home. If you remember early on in the pandemic that we'd have to wash our clothes, strip our clothes off in the garage and run into the house and take a shower. We didn't know anything about these things, and all that emotional trauma result in our staff being very concerned about things, being very anxious about things. They wanted to solve the problem by doing something extra, working extra hard to take care of their families, friends, and neighbors who come into the hospital. But that exhausted them. And as a result of that, we really were at a place where we really needed to help our staff take care of themselves, and trauma-informed care was one of those areas. As the CEO of a health system, you are the person that stands here or is on video, but really the credit goes to everybody who works here at Beebe Healthcare who made this happen, especially the people in our population health division, our employee health division, and every one of our leaders who all recognized that this was something we had to do. It really starts with that level of awareness and also care. And I know that everybody cares for their employees, but here at Beebe Healthcare, because we are a local independent health system, it's not uncommon for you to see someone in the supermarket or see somebody in the school who's an employee or a staff member. We all have to work together to take care of each other. And I think that's one of the reasons why the Trauma-Informed Care program has taken off. And we really are excited about bringing it to the next level.